Assalamu alaikum. The communication day with starting with Mr. George, 75 years, ischemic stroke 3 weeks ago, but wasn't admitted to the stroke unit as no bed was available in the stroke unit at that time and was admitted to the general ward instead. He was now improving regarding his stroke. He's diabetic for 5 years and the blood sugar controlled or diabetes control. Recently developed an infected heel ulcer in his both legs while in the medical ward. Swab from the heel ulcer result came that the infection is due to MRSA, methicillin-resistant Staphylococcus aureus. You are the medical senior hospital and duty. You will sit with Mr. Jack, his son, discuss the issue with him. We'll start now after the timer. Okay, ready?
Yeah.
Yeah, here we go.
Hello.
Hello.
I am Dr. Mudassir, one of the doctors working in the clinic today. Hi, this is Mr. Jack with me.
Yeah.
Okay, Jack. So I just want to confirm you are the son of Mr. George, who is 75 years old.
Yeah, I am.
Okay. Okay, Jack. So I can see from the notes that you wanted to speak to me about something regarding your father. Am I right?
Yeah, doctor. Yeah, I want that.
Okay. So before we start, Jack, I just want to confirm, are you the next of the kin for your father?
Yes, I am the one. That's why I requested to sit with you.
Okay. So before we move forward, Jack, with this conversation, I just wanted to know what are your expectations from today meeting?
Yeah, I expect to give me more explanation about the room my father inside now, and why you put paper on his door, and then why the nurses told me to use something to wear while visiting my father. Can you explain all these things for me?
Yes, definitely, Jack. We are here to help you and we'll answer all your concerns. Let me know, Jack. First of all, I'm very sorry for your father, what your father is going through. But before we start a conversation, can you tell me how much you know about your father's condition? What happened to
Yeah,
him?
yeah, he came with a stroke, and that
Mm-hmm.
day you told me no bed available in the stroke unit. I accepted that. Now you are saying, and your nurse is saying that he has sores in his heel. I think this happened only here. I brought my father was okay. He's non-diabetic, and I'm taking care of him. He never had this sores in his heels or his legs. Now,
Mm-hmm.
in how many days in your hospital? He had this sores? You have explained for that?
Yeah, first of all, Jack, again, I'm really sorry what happened to your father. And this is very important and highly appreciate your concern. But what happened actually, Jack, that you are absolutely right, that your father came with a stroke. And at that time, there was no room with us in the stroke unit, and we shifted him to the medical ward. And he was getting better from the side of the stroke. He's doing much better. But there is some problem which has been done from our side. I'm so sorry to tell you that, as you said, that he's been in a closed room and the nurse is asking you to wear some aprons and gloves because he has developed some what you call ulcers in both heels of his foot. Are you following with me, Jack?
Yes, I want explanation for these ulcers, why and the sores happened now.
Okay. So, yes, Jack, I wanted to tell you that there has been some mistake which has been done from our side. I'm so sorry to tell you about it.
What do you mean, doctor? So you are now saying this is a mistake from your side, right?
Yes, absolutely, Jack. I'm highly apologizing for this condition because what happened is that in the patients with stroke, usually, you have to change their positions very frequently. All right. Okay.
Mm-hmm.
In this case, the changing of the position was not done too much, and the skin usually on the heels is very thin. It's very prone to get some infection. So actually, what happened, because we didn't change his position too much, so he developed the uh, ulcers of the feet. Do you know what ulcers are, Jack?
Yeah, I told you it's sores in the skin.
Yes, yes, absolutely. They are so resistant. And then when we sent for the source for some blood test to see any bugs in the source, so we found out that he's having a bug which is known as MRSA. We call it MRSA.
I don't
Are you aware
understand
of that,
anything.
Jack?
No, no, I don't know anything about that. What you mean by MRSA?
Okay, so let's talk about it. It's a special, it's a type of a bug which is usually found in the source. Okay, and this bug is usually sitting very harmlessly in your body. Okay, but when your defense system gets weak, these bugs come out. Okay, so in your father's case, because the heels gets the sores, uh, it was infected by this bug. Are you following with me?
Yeah, doctor. Then?
Okay, so this bug, we call it in a full term like methicillin resistant staphylococcus aureus is actually the name of the bug. Okay,
Mm-hmm.
so when this bug occurs in any infected sores, we have to actually keep the patient in a side room, in a separate room.
Mm-hmm.
Okay, because it is easily transmissible and can spread to any patient.
Okay,
Are you with
doctor.
me?
Yes, now you are worried about other patients and you are not worried about my father.
I'm so sorry, Jack. It's not like that. We are worried about your father also. That's why we shifted him in a side room and we are giving his full care. We have started the medications also for this infected sores. Okay. And we are following him clinically completely. It's just that whenever any person will go inside, he's going to wear gloves and the apron, which you call as personal protective equipment, which is known as PPE. It's actually the protective wear which we have to wear before we enter the side room. And before we come out, we have to remove all of this so that we cannot spread to any other patient.
Hey, doctor, you are talking again about other patients. What about my father?
Your father is completely under observation. We are following him completely. And don't worry, we have started him on medication and he is improving.
Okay, doctor. So you give him medication by what type, doctor? You mean the medication? What kind of medication you started on?
Okay, usually for this type of sores, we usually give some medication to apply on the sore. As well, we give some medication by the blood channels.
Okay,
Okay, but
doctor.
what I wanted to tell you, Jack. Yes, yes, Jack, please.
Yeah, I want the name of the responsible caregiver for my father who had the responsibility about the bed source. Give me a name, doctor.
Okay, Jack, I highly appreciate your concern, and I know this is very difficult for you to see your father like this, but it was the responsibility of the whole team. Actually, we informed the nursing supervisor also for this, and we are trying to find out what was the main problem.
الثلاث ولا الاربع ايام دول وروني انت تتعامل معاهم ازاي
and
انصفوا لي في
actually what
حاجه.
Okay, go ahead.
and okay, and actually we have spoken to the nursing supervisor also, and he's trying to find out what happened actually with your father. But don't worry, we are giving him full care now. We have now we have hired nurses also who are completely looking at him, and we are trying to change his position completely every now
Okay.
and then.
Is
Okay,
there
I'm so
any
sorry.
yeah, is there any specific person or nurse who's taking care of this source now?
Okay, so there is no specific nurse. Oh, yes, there's always a specific nurse for these stores,
Mhm,
specific type of stores, which you call it's like a store specialist nurse. Okay,
mhm,
she comes daily and she just dresses do the dressing for your father's sores.
mhm.
All right.
Okay, doctor.
Okay. So Jack, I'm sorry that this happened to your father, and we have taken all measures for it, so not to happen to again to any patient or not just your father. And don't worry,
Oh,
there's not going to be any problem from our side about your father. We have already written an report which is known as an incident report. Okay, we have
mhm.
sent it to the we have already sent it to the administration, and they're going to go through it completely. That was the mistake about.
1 minute.
Okay.
Okay, doctor.
Okay. Anything, Jack, I can do for you?
No, doctor.
Okay. So, Jack, I'm really sorry. I just wanted to know who
Mhm.
your father lives with at home.
Yeah, with me and my mother.
Okay. Do you need any type of support from our side?
No, doctor. I just want to my father to be fine and to take him home.
Okay, Jack. If you need anything, we are here. Okay. I'm going to give you
Mhm.
some brochures also if you want to read about this bug. And if you have any questions, please contact us. We'll let you know. Okay.
Mhm. Okay, doctor.
Okay. I just wanted to bring into your notice, Jack, also that we do not leave these matters like this. Okay. We usually arrange some meetings also every month. Okay. And these
Mhm.
meetings are discussed with a team of doctors. And usually they try to find a solution not to happen again to any other patient.
Okay, doctor.
Okay. Okay, Jack.
Okay.
Thank you so much.
Yeah, time is up. Thank you, Dr. Rabia.
You're welcome.
Yeah, I know this is the scenario is little tough,
No, no,
but
it's okay.
because I read a lot of centers,
Mm-hmm.
the scenario is frequently coming in different
Mm,
countries.
true.
So yeah, we have to practice this scenario.
Mm-hmm.
I don't know they like it. That's why I brought it for you. Let's talk about the comments. You did it great in general, so I think no mistake. Just for reminding the others, colleague, you started well by the introduction. You calmed me down. You told me if I need, yeah, that I am the one requested to meet you. Then you ask about the expectation, the next of kin, the what I know about his condition. Okay, and then yeah, when I explore to you, sorry, there is echo. Someone, yeah. Okay, you explain. I give you idea about his disease and
Mm-hmm.
what happened with him. Yes, and why he's isolated.
Mm-hmm.
The best thing you did, you admit the mistake from the beginning. Because if you try to hide or just to negotiate with me that there is something, no, it's a mistake, clear mistake. And I think
Mm-hmm.
nowadays they are writing in the task medical error.
Mm-hmm.
So
Yes, you are.
explain as medical error from the start. And try to finish the steps of medical error earlier, Dr. Rabia. You did it
Yes,
at the
yes,
end,
yes,
but
you're
it's
right.
yeah, better to finish it earlier. Yes, for this mistake, we have had a lot of steps, which are incident report, supervisor, nurse supervisor, meeting with the consultant, and all the team aware about this mistake, and we call it medical error. Don't worry, we will do our best through the office called root cause analysis to prevent this
Mm-hmm.
happening again, this mistake to happen again to your father or other patient. And you know, the steps are clear for medical error. Try to finish it early before
Okay.
going to the next step, which is one of the concern, which
Mm-hmm.
was the isolation.
Mm-hmm.
Yeah, you address the isolation well. There is, we always do a screening from the source, sometimes because of late healing, sometimes to have anti-bug proper for the bug inside the sore. And usually the skin bug present around on the skin and around the sores. It might be
Mm-hmm.
spread to the sores. And when we have test for that, we found it's there. However, it's not spreading beyond the wound because there is no signs of bacteremia or septicemia or whatever, just maybe colonization in the wound. That's why I ask you what medication you give to me to my father, you told me accordingly. Yes, it's a good option. Sometimes
Mm-hmm.
starting by topical medication
Yes.
or some liquid to put on or some antiseptic medicine to put on, and up to sometimes some antibug will be given through the blood channel. Plus some action for the bed sores, which is a mattress. Be sure that the mattress is working well, the air mattress, and positioning every 2 hours by a specialized nurse. And the name of the nurse, as I ask you, if there any specific, yes, there is tissue viability nurse every day visiting in the morning, checking, assessing,
Mm-hmm.
and
Mm-hmm.
giving advice to the bedside nurse what to do and what to apply. Uh, the closure of the scenario to ask about any support if I need or any host dependent if you want. Before leaving, you hand him some leaflet brochure about the source, how to take care, how to
Yes.
uh, treat, and how to manage. Yeah, I think you cover it well. Just to be uh, rearrange of the
Yes.
ideas, which is will you'll start with and which will be at the end and so on. Okay.
Okay.
Yeah, thank you,
Okay.
Dr. Bia. You
You're welcome.
can write your scenario to start
Yeah,
until
I
I
will
will
text you.
write.
You can write it on this. I will just give me
Yes,
a
sure,
second.
sure.
I will text you. Okay.
No problem. I will read the comment until you finish. They
Mm-hmm.
are called tissue viability nurse. Yes, Dr. Fadi, thank you. Yes, send me, Dr. Rabia. I'm waiting. If
Okay.
just ulcer without MRSA, how to handle the same? Yes, of course, the same. It's the error here is developing an ulcer inside the hospital. Suppose no ulcer will happen or no sores will happen in the hospital. Yes, it's possible, but at least do all the steps and the precaution not to happen. And if the family uh, proved to you and told you there was no sores, so means no sores, and this sores happened inside your hospital, and it's considered as medical error. MRSA, it's a screening test, so it might be infected, it might not, whatever. The error here is not the infection, the error is the ulcer itself. Okay, the same, yeah, the same steps, doctor. Okay, any other question, any comments? Share with us the ideas. Okay, thank you, Dr. Rabi. I will share to the Zoom. Yeah, this scenario also, thank you, Dr. Rabi, for this scenario because also this scenario is high
Yeah,
yield
this is very
nowadays
common
also.
scenario. Everywhere it's
Yeah,
happening.
yeah, they like this scenario as well. Okay, Mr. Jack, 65 years man, known case of dementia, admitted recently with pneumonia, was started antibiotics. After 7 days, pneumonia got better, but patient developed profuse watery diarrhea. Stool culture suspected Clostridium toxin infection. He has started on antibiotics again for Clostridium difficile toxin, but seems not to be improving. Daughter Sarah wanted to speak to you, inform her about the condition and further concerns.
Okay, you can just add Dr. Vasim in this that prognosis is guarded now. Okay,
Yeah, the prognosis is worse now.
it's worse now.
Okay.
Once you're ready, tell me.
Yes, yes, I can. Yes, I can hear you.
Okay.
Yes, worse prognosis. Yes. Okay, ready?
Yeah, ready.
Okay. Hello, I am Dr. Mukhtar, the doctor at the clinic today. I'm speaking with Mrs. Sarah.
Yes, doctor.
You must be the daughter of Mr. Jack.
Yes, doctor. I'm the daughter of Mr. Jack.
He is 65 years.
Yes, he's 65 years old.
Yeah, we are here to discuss his health issue. Is that okay with you?
Yes, doctor. I've actually asked for you to speak to me, okay? Because I don't know what happened to my father. I just went to a conference in France. It was an urgent conference for me. And when I came back, they told me that they took my father to the hospital. He was having some problems. So I just wanted to speak to you about it.
Yes, we are here to discuss that with you. Is that okay?
Yes, doctor.
You are the next of kin for Mr. Jack.
Yes, doctor.
Okay. Can you tell me what you know so far about Mr. Jack condition?
Yeah, doctor. Actually, he's a known case of this memory problem you called Alzheimer. And he's been doing a little well, except he doesn't recognize me very well. But he was having some difficulty in breathing and some cough when I went for the conference. When I came back, uh, the housekeeper told me that he took my father to the hospital. And so I just came to see to him, but I could not find him on the bed. So I wanted to make sure where my father is now.
Yes, I appreciate your knowledge about Mr. Jack condition, and I will address all your concerns. Before that, I can ask you what's your expectation about this meeting?
My expectation is that doctor, you will give him some medication and he will be back to his home baseline status.
Yeah, I appreciate your worry, Miss Sarah, about Mr. Jack condition. Let me address your concern, starting from where is your father now? Okay, actually, as you told me, yes, you're updated about Mr. Jack condition. Apart from he's on the in the hospital now for the last period of time, and when we have done some tests, we have found he has a bug, and this bug in the sorry for this in this stool in his back passage. So for this bug, we had to put him in a side room. This is the first concern. You get
Doctor,
that?
he came with pneumonia and he had diarrhea now. What are you trying to say, doctor? I am not
Yeah,
understanding anything now.
yes, I appreciate your worry, Miss Sarah. I just wanted to say that Mr. Jack in a side room because of the diarrhea and the loose motion because of some bugs in his gut being more overgrowth rather than the other good bugs. I will explain to you if you want, but I want to tell you and to assure you that Mr. Jack in a side room and his condition now, uh, under observation, and we are following him just to put him in outside room to be away from others, not to get other infection and not to spread this infection. Did you get me?
Doctor. Yes, doctor, I'm getting it. So where did this bug come from? He never
Yeah,
had anything at home.
yeah. If you give me chance to explain, I will explain to you.
Yes, please,
So
doctor.
he came with the chest infection in his lungs, and for that we give him the best interest antibiotic for his condition according to the guidelines in the hospital.
Mm-hmm.
However, these antibiotics, when we give to weak defense system patient, sometimes in the gut of if any person, especially those with the weak defense, inside the gut we have two kind of bugs, and they are living in balance. The good bugs and the bad bugs, both are in balance. Once the good bugs or the bad bugs being more overgrowth or uh, more large in number, they produce some toxin inside any person, especially those with weak defense system. That happened with Mr. Jack, and that's why he had what's called Clostridium difficile diarrhea. Don't bother about the name. It's as I told you, it's a bug inside his gut being secreting a lot of toxin, and because of these toxins, he had a loose motion. Did you get that?
Yes, doctor, too much information, but I got it. I am not worried about this all physiology, whatever you told me, okay? I just wanted to make sure you give the medications for the chest infection and these medications cause the diarrhea. Am I right?
Yes, it's one of the unwanted effect. However, it might happen for any person, not only Mr. Jack condition.
Okay, doctor. So, as far as I know, his how is his pneumonia? Pneumonia is fine.
Yes, regarding his pneumonia, it's much better than he came. However,
Okay.
now we put him in the side room, as I told you, just to be sure he will be out of this infection from the gut.
Okay. At
Are
least
you
you did
following me?
something good, doctor, by treating the pneumonia. What about this diarrhea, doctor? In how many days I can take this my father home now?
Yes, I appreciate your worry again, Miss Sarah. However, it takes some times to be in a side room and to start him in another antibody for this diarrhea. Till resolution of this diarrhea, we don't have any frame of time to tell you about. However, we are here. We are trying to do our best just to cure him from this diarrhea. Plus, his general condition, as you know, he's having a loss of memory and with frequent chest infection. Our team thinking that his prognosis or his outcome is not good. Are you following me?
Yes, doctor, I'm following you, but how are you treating this? What do you mean by number one prognosis is not good? And what do you mean by that? What are you giving him medications for this? Are you giving him now the medication to control the diarrhea?
Yes, we are giving antibug for the diarrhea. Plus, we put him under follow up with a team called palliative team. This palliative team will follow up Mr. Jack in the coming days, and he will be sure that he has no infection, he has no dehydration, he has no depression, and we will try to do the least support or the maximum support with least stay in the hospital in order to be with you and with his family.
Okay,
Are
two
you
minutes left.
following me?
Yes, doctor,
Yeah.
I am following you, doctor. But you are not giving him another antibug. Now, first you give him one antibug, now another antibug. You're just going to will not let my father go home by giving this antibugs continuously. What is the need to give antibug now if his condition is not good, doctor?
Yes, I appreciate your worry. Be sure this antibug, the new antibug for his new infection in the gut, and it will try to eradicate and to kill the harmful bug inside his gut. Are you
All
following
right,
me?
doctor. Yes, doctor.
Okay.
So that means,
Uh,
doctor, his condition is not good now.
yes, this is
You
in
understand?
general. Yes. Can I ask you some question, Mr. Mrs. Sarah?
Yes, doctor.
Yes. Who's living and taking care of Mr. Jack?
Yeah, doctor. Actually, he's living with a housekeeper at home. It's like a person who takes care for him, but I come and go because I live just nearby to him. So I just come and go and visit.
Do you need any support?
No, doctor. Currently, no. If I need it, I'll let you know.
Yes, and he can do his daily activity, or he need this caregiver to do that.
Yeah, the caregiver usually does it, doctor, but at least he eats by himself, he sits by himself, he can walk up to the washroom. However, as I told you, he doesn't recognize any one of us. But
Okay,
not like this, doctor, as I see him now.
I appreciate that. I will leave the hospital number, contact number. If you need any kind of support, you can contact us. Plus, I will hand you some leaflet brochure and website about the gut infection he got inside the hospital. And don't hesitate to call us anytime for any inquiry. That's okay.
Okay, thank you, doctor. I'm finished.
Okay, thank you. Time is up.
You're welcome, Mr.
Yes.
Qasim. Sorry, I was a
No, it's
little bit,
okay.
because it's a scene of an angry patient, an angry son,
Hmm.
angry daughter.
Hmm.
Okay, so you did well.
Yes.
You started with good introduction as usual. You give
Hmm.
the introduction of you, introduce yourself to the patient, ask for the next of the kin. Okay, but I felt that you started with the diarrhea first rather than the pneumonia first. Okay, so for me, I feel that I would have started from pneumonia, that he came with pneumonia. Actually, we gave some antibiotics to the patient, and with this antibiotics now he's doing well. But what actually happened, there's these medications has a problem. As you discussed, it was actually very good, some harmful bacteria, some harmless bacteria, so it weakens the defense system. It was all fine. So for me, I thought that you went into the diarrhea first and then you came into pneumonia. So I think it's okay, whatever, but the discussion was fine because it's one of the side effects of the medication, and the patient did not look good. And prognosis is poor means that maybe he's not going to come back to his usual state. Okay. Uh, uh, the, uh, the mentor which discussed it, I'm not sure. Is it you should bring palliative care or not within it? Okay. Uh, Okay, so I am not sure that palliative care is important or not. Okay, because time is very short. The angry daughter is going to give you a difficult time. Okay, so as as you treated the pneumonia, the antibiotics were working really well, but they treated the pneumonia. Side effect went into the diarrhea. Now we are giving some other antibiotics, yeah, anti-bug medication, which will not affect usually any part of the body. It will work on only the gut, the swollen gut. Okay, because
Hmm.
we usually give oral vancomycin. Okay, so oral
Hmm.
vancomycin of the passing usually have local effects rather than IV vancomycin. Okay,
Yes.
so usually what happens is that when this bacteria gets out of balance, this harmful bacteria come out and it secretes toxin, yeah, it secretes this protein that actually gets the soreness of your bowels. Okay, and that's why the patient starts having bloody diarrhea or whatever diarrhea. Okay, so
Hmm.
the medication now we are going to give is just going to act on the gut soreness. So usually we are not going to have any other side effects. But currently, I wanted to inform you that your father is not doing good. Okay,
Yeah.
it's because even his immune system is compromised because, as you told me, he's been having some memory issues also, and he has multiple admissions before of pneumonia also.
Hmm.
So this time is difficult that he would make it. We are trying our
Hmm.
best for him to get better, but I would like to inform you that he's not in a good shape. Okay, if you have time, you can talk about. People discuss about it. If you have time, you can talk about a power of attorney and lasting wish and a documentation. But if you have time, it's not necessary. If you
Hmm.
want to mention, you can mention palliative, but I feel there's no need to mention palliative here. Okay,
Hmm.
because it's
Okay.
not mentioned any here about palliative because you have too much to speak of. It's going to give you a tough time in pneumonia and then diarrhea, so you have to explain two things. If you have time, you can go for lasting power of attorney, but I don't think so. You don't need to mention palliative care, okay?
Yeah,
If mother wants to come in, they can come in. This is what I feel.
yeah, okay. But since you told me the prognosis is poor,
Yeah.
I guess,
Prognosis is
yeah, I
poor
guess,
means
mhm,
is it mean that maybe he's not going to come to his baseline. That's why I told you again and again. He's just
mhm.
sitting, walking. He doesn't recognize this at all, and there's a helper for him. Okay.
Yes, yes.
Currently, the prognosis is not that good. How many days, for example, a usual Clostridium difficile you can treat in like 5 days, 7 days,
1
but
week.
maybe
Yeah.
this is this will take around 2 weeks or 3 weeks, okay, for him to get better. And if he's going to get better, I'm not sure he's going to come back to his baseline or not.
Yes, yes.
Okay, yeah,
Yeah,
this
I
is the
agree. Yeah, thank you.
you're welcome.
Thank you, Victoria, for the scenario. And I can read some comment here. Pneumonia changed to other antibiotics. I think you didn't mention. Yes, yes, I missed this point. I should say that we stopped the offending drug, which is the previous
Yes,
antibiotics for the pneumonia, and we started the antibiotic or the antibug specific for the gut infection or the diarrhea. Yes, you're right. The second comment, it can't happen in all patients. Yes, I mentioned this. In elderly weak system or a defense system, yes, it happen more common than the young or a normal immunity system or normal defense system patient. No issue of palliative, yes, I agree, yes, no need to mention palliative. Poor prognosis is just for the acute setting, yes. But in general, yes, he will not come back to his baseline, or maybe he will be to his baseline. However, his baseline is not that much good.
hmm, hmm.
So yeah, I agree with the comment and with your comment, Dr. Aga. Thank you. Yes, these two scenarios are frequently. I read it in center in Mumbai center today, and I read also. I think in Kenya center, yes, it was there.
Yeah.
So I think
In
yeah they are focusing on these scenarios,
every
but
center,
no
I think even
medical error.
Pakistan in two diets they have bought it regularly. So I
Yes,
think this is
yes.
very common all over.
Yeah, but no mention for medical error in this patient. It's unwanted effect
No.
or side effect
Yes.
of medication.
Yeah.
So yeah, uh, don't do the steps for medical error.
Yeah.
Yeah, thank you, Dr. Rabia, for practicing today with me. I hope
You're
all
welcome,
will
Dr.
get
Basan.
benefit. Yes, thank you so much.
Yeah.
I hope all will get benefit from these two scenarios as they are high yield nowadays. Any question, any comment about this scenario or any other communication scenario? Is the lasting power of attorney must I mention here? I think it's not that important, but at least, yes, you can ask about the advanced directive because his poor prognosis, he might be
Yes.
worsening and he might be also deteriorated more and more, and he might
Yes.
need ventilator. If he told you no, my father said no for intubation, no for ventilation, it will ease the decision from the medical side. So yeah, no, we can mention the advanced directive. We can mention it because
I
his
think, Dr. Basan, if
prognosis.
you have time, mention it. If you don't have
Yes,
time,
if
don't
we
put
have,
yourself under
yes,
pressure,
yes,
okay?
yes, if we have time, yeah. But instead of palliative, so it's yeah, compared to the palliative point, I think the advanced directive will be yes, an acute presentation, but he's coming with frequent pneumonia, for example, and he might also have deterioration. We don't know he might recover or not. To be safe, okay. For somehow I agree not to mention anything, but I think since they are writing patient with good poor prognosis or deteriorating or his conscious level is not okay, and dementia also here, don't worry, don't forget the dementia. He has dementia, and the dementia means chronic one, not acute one. The delirium, okay, I agree if he had delirium for the current admission, but since he has dementia, it might be worsen and it might he might lose his conscious level permanently after these infections, and you don't know what will happen in the future. That's why I raised this issue. For me, if I face this scenario and they told me he has poor prognosis, I will ask this question. Okay, this is for me. But to be safe, it's okay for you, doctor, if you want not to mention. But for my humble opinion, I will do raise this issue only for the advanced directive because he might deteriorate and he might be intubated or need to be intubated or need to admit to ICU. By this comorbidity, he will not get any benefit from these things. Yeah. Okay. If no more questions and comments, we can end the session early today. Thank you, Dr. Rabi, again. Thank you all for
Thank you,
sharing
Dr. Hassan.
comments. Yes, okay.
Thank you.
See you tomorrow, inshallah, with clinical consultation. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.